When an MLT wants to add an activity to their continuing competence learning plan and/or activity log, the MLT will first be able to review their previously submitted self-assessment and learning plan. The CMLTA encourages members to review this prior to completing their learning plan to ensure that the activity actually met the learning plan set the previous year. The MLT will first be asked to identify what activity they did to complete this learning goal. Looking back at the self-assessment, the MLT wanted to increase their professional knowledge because a new analyzer was coming into their laboratory. They wanted to learn the new process and review proper specimen integrity and type, turnaround time, testing methodology, quality control, and quality assurance. The member knew that increasing their professional knowledge would help them troubleshoot, and understanding specimen type, QA, and QC will help decrease turnaround time for patient results. Not only was this activity going to impact their service users, but help with their own confidence when performing the test. This MLT decided to review subject matter relevant to their professional practice. The MLT must then select the date in which the activity occurred. With the new program, multiple dates can be selected. How to do this will be shown in the next activity. The MLT must then provide the topic of the learning activity. For this example, the topic was regarding the new analyzer in the hospital laboratory. Here the MLT could name the actual analyzer. The MLT must then identify at least one takeaway from the learning activity. For example, the MLT may write, "One of the key takeaways I took from reading the manual for the analyzer was the importance regarding the specimen type. In the laboratory, we used to accept blood samples on a green top tube, but the manual now states that it needs to be an orange top tube." The next question asks MLTs to identify at least one impact completing the learning goal had on their professional practice. For example, the member may write, "Knowing this knowledge will help me when I am accepting samples for the test. If it has been collected in the wrong tube, I will be able to quickly talk with the individual, nurse or lab assistant, who collected the sample and ask for a recollection." The MLT must then identify at least one impact this learning activity had on their service users. Remember, service user refers to any individual who uses MLT services, including patients, clients, students, employees, or any other group. For example, an answer to this question may state, "Now that I know the appropriate sample type, I will be able to ask for a recollection faster if it is collected in the wrong blood tube." This hopefully will decrease the turnaround time for the patient and doctor who need the test results. Remember, the goal of the Continuing Competence Program is for members to not only identify impacts on professional practice and service users, but also apply the knowledge, skills, judgments, and attitudes to their professional practice daily, improving public safety in Alberta. Therefore, the last question will ask MLTs to identify at least one application of the learning to their professional practice. For example, now that this MLT has reviewed the analyzer's manual, they will apply this knowledge by accepting appropriate and rejecting inappropriate blood tubes. They will also help educate others regarding the sample type and explain to them why the sample type has changed and why it is important to always be aware of proper sample types. I now know that I will never accept a green top blood tube when performing this test on this new analyzer. Here, the MLT can also provide additional supporting documents if they wish to do so. This is not required, as the evidence that learning occurred and its application was provided when answering the above questions. Now, the member can add 2 additional planned, unplanned learning activities in their activity log. Remember, these do not need to be related to the learning plan you completed previously. This is just a place for members to add an activity that may have come up during the CCP cycle year that impacted their professional practice. The questions are similar to the previous activity, the first of which asks members to identify the type of activity, such as observing consult with a peer expert or sharing knowledge/expertise as a trainer/mentor/preceptor. Then the MLT will select the date in which the learning occurred. If the learning occurred on more than one date, the MLT can add additional dates by clicking the Add button. The MLT will then identify the topic of the learning activity. For example, for this activity, the MLT had a student come into the laboratory and they had to teach them about the urinalysis bench, including troubleshooting. This question asks members to review the standards of practice and code of ethics and select one to which the activity was most closely related. For this example, the MLT selected the practice standard communication and collaboration. The MLT must then identify at least one takeaway from the learning activity, such as, in this activity, I learned that I need to teach critical thinking when I am assisting students in the laboratory. If they do not know something but I do, it is not always appropriate to just tell them and hope they remember, but teach them how to find the appropriate source of the information, such as the standard operating procedure. The next question asks MLTs to identify at least one impact completing this learning goal had on their professional practice. For example, after working with the student, I hope to help other students with troubleshooting and critical thinking. Just because I know the answer does not mean that I should just tell them the answer. I need to say, good question. How do you think we should move forward, and where do you think we could find the answer to that question? This will hopefully help the student gain those critical thinking skills that are so vital in the laboratory. The next question asks the MLT to identify at least one impact the learning activity had on your service users. Again, the term service user refers to any individual who uses MLT services, including patients, clients, students, employees, or any other group. This MLT answered the question the following way. Proper teaching and mentoring students will help make sure that the future MLT profession is releasing reliable results. One day these students will be MLTs, and they need to be able to troubleshoot and be able to think critically when they have questions. Sometimes, we work alone, so finding the appropriate resource is vital in those situations. The last question related to this activity asks for at least one application of the learning. For example, an MLT may start not providing all the answers to their students who come into the laboratory. Standard operating procedures do change. Therefore, simply trying to remember everything is impossible. They may stress the importance of instilling this in their students so that when they are MLTs, they think critically when they run into issues in the lab and can find the appropriate information to solve the issue. MLTs can also upload supporting documentation if they wish to do so, but again, this is not required as demonstration of learning and application of learning is assessed in the answers to the previous questions. The MLT will be required to add one more unplanned supplemental activity. Again, this does not need to be related to any standard of practice entered in your learning plan. This allows MLTs to include learning that occurred that was not planned but still impacted their professional practice. For this example, the MLT chose performed and/or reviewed external/internal proficiency samples. They provided the date in which it occurred. They provided the topic of the learning activity, hematology, peripheral blood smear proficiency sample, and related it to the practice standard, professional knowledge. The key takeaway from the learning activity was that when they received this proficiency sample, they realized they had a hard time and questioned themselves regarding the level of polychromasia. After this activity, They realized they needed to review some more slides with polychromagy and compare results with other MLTs until they felt more comfortable. The MLT then identified at least one impact completing this learning goal had on their professional practice. They stated, "After reviewing additional slides and talking with fellow colleagues, I now have increased confidence in the proper identification and level of polychromagy in peripheral blood smears. This will ensure that I am releasing similar to other MLTs' polychromagy levels." The next question asked to identify at least one impact this learning activity had on their service users. Again, service user refers to any individual who uses MLT services, including patients, clients, students, employees, or any other group. For example, partaking in this activity enabled me to identify an area that I needed to review, which will help make sure that patients are getting accurate results that another MLT would agree with. We do not want a sample to have varying levels of polychromagy because that could impact patients' diagnosis/care. The last question, again, asks the MLT to identify at least one application of the learning to the MLT's professional practice. For example, I will continue to work on my polychromagy identification and quantification. This is very important for patients, so I need to feel confident when releasing my results that they would be similar to other MLTs. I will return to the peripheral blood smear proficiency sample in 2 months to ensure I am still getting similar results. Again, the MLT can add supporting documents if they wish to do so, but this is not required. If an MLT would like, they can add up to 3 additional learning activities. The questions associated with these additional activities will be similar to the supplemental planned/unplanned questions. Please note that these will only be observed or assessed if you are randomly selected for audit, and there is an issue with the information provided in the supplemental planned/unplanned learning activities. The MLT can then click Submit when they have finished providing the information required. The information will then be saved for the MLT.